Arnica, Montana. Leopard's bane. Excessive consumption of the arnica plant causes muscle pain, accompanied by a strong sore and bruised sensation. These symptoms often appear after physical exertion or after an injury. In such cases, the homeopathic remedy arnica can be of great help. Arnica states often develop after acute or past injuries. In some cases, however, an arnica state may develop in illnesses which have not been caused by an injury. Arnica is mainly used in bruises, sprains, contusions, or after surgery. It is most effective in cases where blood has entered the soft tissue, be it a simple small bruise or a large-scale injury. The patients complain of a characteristic sore or bruised feeling, everything hurts. They are anxious to avoid moving the injured part and are afraid of being touched. It is striking that despite the state they are obviously in, these patients will assure those who have come to help that they are perfectly well and that the helpers may leave. The patients withdraw, urgently desiring peace and quiet. When the trauma has been more severe, the patients are dazed and absent-minded. If asked a question, they will briefly pay attention and give the correct answer and then immediately slip back into their dazed state. A red, hot face with a cold body or cold extremities are characteristic in these patients. This combination of symptoms may be found specifically after severe trauma, but also in acute infections such as scarlet fever, malaria or erysipelas. These patients' discharges, their breath, sweat or whines all markedly smell of rotten eggs. Apart from its use in acute cases, arnica is also used in the treatment of chronic illnesses. The causes of these illnesses may often be traced back to a physical or psychological trauma dating back some time. Strong fears of anyone approaching or of direct touch are characteristic features here. Arnica is therefore very helpful in ailments following sexual violence. Physical pathologies may result from the pain that the patients experienced and that was not dealt with adequately. These pathologies may lead to nocturnal complaints and anxiety attacks, often in cases of angina pectoris, as well as to fear of imminent death. The constitution of healthy arnica types is athletic and robust. These people are mostly found among farmers in mountainous regions, lumberjacks or other people who work in the forests. Despite their robustness, however, they react to pain in a surprisingly sensitive way. Subconsciously, they are extremely scared of injuries and show a clear aversion to being touched or to anyone approaching. Recap. Ailments following acute trauma. Strong aversion to being touched. Says that he is well although he is severely injured or ill. Very dazed, answers correctly when asked, but sinks back into previous dazed state right away. Pain does not allow patient to find a comfortable position, even the bed is too hard. Hot head and cold body or, the top half of the body is hot, the lower half is cold. Awakening at night due to strong heart pains which extend the left elbow. Bleeding or pain after dental treatment. Epistaxis while washing the face. Stroke accompanied by a very red head and a full, strong pulse. Sore and bruised sensation after giving birth.